Hello and welcome to the GE Centricity Electronic Health Record documentation for the Massage Therapy Department. Please note that a prerequisite for this training is the GE Centricity Readiness Checklist for providers and interns. You can find this document on the Training and Resource SharePoint link found on the RDS cluster link here. When you double-click on the Training and Resource link, it'll be opening up the links and documents available. Under the documents available, you will see Readiness Checklist for Providers and Interns. Also the Massage Therapy EHR Documentation Guide. The documentation guide shows how there are 3 different encounters that massage therapists will see: an initial evaluation, a daily visit, and a progress report. Please note that this is now the new format of SOAPR, Subjective Objective Assessment Procedure and Recommendations. For this training, I will go through the daily visit. Then I will go through another training to understand the initial evaluation differences. The only differences in documentation is the subjective portion. There are different forms loaded based on which type of visit that you will see. For this video, I will go through the daily visit and understand all the forms needed for the daily visit. In a shorter training, I will also outline the different forms used for initial evaluation and progress report. In addition, I will also review the key concepts and workflow for massage therapy, such as orders, care alerts, preferences, routing, and adding a self-pay diagnosis code. Once you have reviewed the readiness checklist for providers and interns, you will understand the reason for this. This is important because it reminds you about setting your location of care, your schedule preferences, and practice opening a document, and important things such as remembering the clinic date, location of care, and associating it to the provider's schedule. You'll also learn tricks about how to sign a document as an intern, how to end a note, and route it to your provider or yourself, and other resourceful tips. Again, the resource link is found on your desktop. Okay, once you're logged into the CPS, either the production or the training environment, you will see a schedule linked here. For this purpose, I logged into the training environment and loaded some demo patients to the schedule. You'll see here Mickey Mouse is checked in. For this reason, I'm going to double-click, or you can highlight and click Open Chart to open Mickey Mouse's chart. Once the chart is loaded, you will see the chart desktop. Please review the EHR 101 training and understanding the difference between chart desktop and the patient's chart. For this training, I'm going to highlight the forms needed for the daily visit note. From here, you will click New Document. And for this training purpose, I will click on Daily Chart Note. In the production environment, this checkbox will be associating the existing patient to the appointment on the clinical date, such as today. Click OK, and you will see the forms loaded. When you open a chart, notice how you open another link. You still have your chart remaining, and now you have an update for Mickey Mouse. On the left-hand side, you'll see the forms listed, and on the right-hand side, you'll see the form that is in use. You may navigate between forms in 3 different ways. One, by selecting the form here and hovering down and changing and highlighting here. The second way is to follow these bars found on the right and left-hand side of the screen by clicking Next Form or Previous Form. And the last way to navigate is on the bottom of the form. There's a button called Previous Form or Next Form. I typically use the left-hand screen. couple other things before we begin documenting the note to be aware of is the top version here is highlighted on Forms. When you click the text version, you will see these forms are ready to be loaded. When you select things in the form, it is automatically translated into the text version, which ends up becoming the note. If it is highlighted, it doesn't understand what you're trying to say, so therefore, now it entered the information. Another thing to be aware of is the different ways you can document. Many of the documents here you will be using checkboxes, and when you select the checkbox, it automatically imports the information selected into the text as a sentence or a section below the header. Another version is called a drop-down. You will see an arrow here allowing you to select different options of the drop-down. This information is also automatically preloaded into the sentence of the text. The last version is called a radio button. This is allowing you to only choose one or the other, unlike checkboxes where you can select multiple. Now let's review the content in these forms. The first form is called Massage Therapy Goals and Emphasis. In this form, you're going to describe the client's goals or reason for the massage session and describe the requested types of massage modalities or emphasis on the session. So for this example for Mickey Mouse, I'm going to say, today is for general relaxation and would like to request emphasis on the shoulders. There is no specific auto or work comp claim or referring physician, and there is no delegated amount of time on a specific area. But he does request Swedish relaxation, possibly trigger point, and maybe a little bit of clinical massage. He requests a full body relaxation and wants more emphasis on right shoulder versus left. On the bottom of this form, you will see treatment summary was discussed with the client and informed consent was obtained. All of the questions were asked and answered to his or her satisfaction. This checkbox is automatically loading into the text. The next form is Complaints and Symptoms. Please note the Complaints and Symptoms form has 3 tabs found on the top. The Complaints and Symptoms 1, Complaints and Symptoms Detailed, and Provider Notes. If you are the type of person who wishes to write a narrative, Mickey Mouse presents with shoulder pain, and continue on typing in a narrative form, you may do so here. This will automatically preload as a Provider Note subheader into the text version. The other way to describe the complaints and symptoms or any details of the current area of complaint, you can do so here by indicating an area of the complaint, possibly a history of, complains of, or indicate some description such as pain with a rating today of 6. If you would like to be more detailed in indicating right or left, or specify in the actual area, you could indicate it here. In addition, I'm going to use the example of the feet being sore. Next, we are going to document any history or changes to the symptoms since it began. On the bottom of this form, you will see many options such as symptoms began a year ago and indicates the drop-down of an accident was how it began. You can also indicate that there was a shoulder surgery or changes to the health history in this box here. Symptoms increase with, there are many options here, and decrease with, there are many options here. For this example, I'm going to select a couple and continue on. Last, you can select any previous treatments they have had, such as physical therapy, acupuncture, healing touch, chiropractic, or massage. And if you would like to report if there's any changes since those treatments began, such as resolve, notable changes, some improvement, and so on. You can also indicate your changes to the symptoms or history or how it increases or decreases in the other comments section. On the second tab of Complaints and Symptoms, this is where you can get more detailed, such as the nature of the symptoms, examples listed here, or type an example in this text box, with an overall rating of 6. Please note that you do not have to check on everything, and this is more of an option for you as you type. You can also indicate today, best day, worst day, and on average. You can indicate the frequency and duration, the onset and progression, and any activities of daily living. You can also indicate any limitations that they know of to their range of motion or activities of daily living. If the client presents with more than one symptom and you would like to be detailed on each symptom, you can do so by using the next form. Complaints and Symptoms 1, Complaints and Symptoms 2, and Complaints and Symptoms 3 are the exact same forms with 3 tabs on top. It will indicate the number of the complaint, so therefore your documentation reflects properly. I'd like to reflect back on the massage therapy guide. Just to understand, in previous notes we've used the objective portion to indicate the procedure or the summary of our session. In these notes, we are using the objective solely for palpation findings and quality of tissue, both regional and specific, per massage techniques used. The next 3 forms are muscular system forms. In an effort to provide all of the muscles into these notes and to reduce the spelling errors and to allow interns to actually know the area in which they are working on, we actually loaded 639 muscles into these forms. So in order to fit them all in, we had to break them up into 3 different forms. The first is the head and neck, the next is the back and torso and arm form, and the next is the glutes and leg. For those of you who are very visual, another way to remember where you're working is we sectioned out from the clavicle up as the first form, from the hips up is the second form, excluding the head and neck, and from the waist down is the third form. In the muscular system head and neck form, you'll see 2 tabs at the top. The reason that we broke up regional findings and specific detailed findings is that you can indicate an entire region as a general description, hypertonicity, unhealthy, or healthy. But in a specific or detailed muscle, you will indicate your detailed findings per clinical techniques used and the hypertonicity scale. Let me show you an example of how to load a muscle. I will say in this example, as a region, the qualities of the tissue palpated during the massage session were scalenes. The left side was hypertonic. The right side seemed hypertonic, but they were kind of different. So I'm going to say the right side was a 3+ and the left side was a 2+. I can also say details as unhealthy, stuck, stringy, taut, tense. These lists are all in alphabetical. And then healthy descriptions. So even if you don't find something in a massage session, you can still indicate healthy descriptions of that muscle here. For this example, I'm going to say the left side was stuck and stringy and the right side was fibrotic. Once I am done loading everything in this area about that one muscle, I will hit Save and Import. It will take all of that information and translate it to the text version very nicely by having a scalings listed here and indicating hypertonic on the left, hypertonicity scale 2+ out of 4+ on the left, stuck stringy on the left, hypertonic on the right, hypertonicity scale 3+ out of 4+ on the right, and fibrotic on the right. This allows you to compare right or left side and give many variations of what you palpate. For a specific or detailed finding, again I'm going to select scalings, but I'm going to say the right side I found an active trigger point with an hypertonicity scale of 3+. You don't have to do the hypertonicity scale, but please note it is used on chiropractors and it is very easily referenced from a 1- to a 4+ scale, 1 being soft like a pillow and 4+ being hard like a desk. From here I'm going to import this information, and the reason for this last step is because this is where you can indicate the referral pattern. I'm going to say referral to the right eye duplicating the headache of yesterday. There are many different types of referral patterns, duplications, or sensations that you can get from clinical massage techniques. That is why this text box is here, for you to add any extra detail about that specific muscle that is not listed in these options here. In this form, the back, torso, and arm form, I'm going to indicate a specific detailed finding of splenius capitis, left side point tenderness location with the 3+ and imported. But then I forgot that it was actually on the right side. This is why the clear and undo button is there. If I go to select more information here and hit save, it won't let me. I have to undo that information about the radio button I have selected before changing it to the right side. So I will say the right side we had a trigger point, and this is where you can indicate your referral pattern again. And so on. Then you will see that it translates all of that information at the end of the details that you have selected. Most often, however, if you're not using trigger points and referral patterns, you will use the regional findings section. In here we can select a region and give a general description in here. So we could say it was moderate or constricted or fibrotic on a bilateral level and import that information quickly into the full text translation. So going back, I'm going to add again the left side of the trapezius was stiff, or as a healthy description, malleable. There are many options here. Just remember that it's a 3-step process when using the muscular system forms. First you select, then you indicate the description or hypertonicity, and then you hit save and import. In the muscular system back and torso and glute and leg form, there is actually 3 tabs. That's because the specific detailed findings and or specific muscles are all listed, and there are many of them, so we had to put it on another page. So please note that there are more tabs in these 2 forms. Once we move on to the assessment form, you will see there are some details that are listed here that we couldn't fit in the muscular system form. So we noted that this is observations and changes noted during the session. You can indicate anything that applies. And the list is here, such as talkative or falling asleep, unable to relax, and so on, giving you the option to select more than one. Under this section, you will see the assessment area. In this, you will want to give examples of notable changes due to the techniques used, such as relieved symptoms, melted, loosened, or anything that the client feels after the session. You may indicate quotations or a new number after the session here. If anything that you have found is not in these forms, each form has a provider's notes section allowing you to type in anything that you would like in the provider's notes. Going back to the forms, I am on the form, sorry. Going back to the form listed here, you can also indicate specific favorable techniques that were used. Let's say in this case I used movement education or a specific technique and it was very favorable to that session and I want to make note of it for future sessions. You can select those here. The next form is called MT Summary. It's the summary of session, also known as procedure, but since we don't actually provide a procedure for this session, I changed the form to call MT Summary. This is where you list out the details of the session, when the session started and when the session ended, or exactly how long was the session. You will see those are different, so you can do either or here. For insurance purposes, it is recommended to actually indicate the specific time of the session start and end. You can select many options in this form, such as positioning during the treatment, any session details, if there was any heat, and the specific modalities that you did for that session. If there was additional techniques that you did that you want to remember, you can indicate it here. This is where you will indicate the treatment area that you provided for that session. And on the bottom, there are some extra notations. The treatment plan was discussed with the client and informed consent was obtained. This is your verbal consent for the treatment, and it is suggested to select this checkbox in the procedure section. If you will notice, there is a big yellow button here called Go to Orders. I will highlight in another video how to select an order for your session, but before ending your note, you will have to select an order for the documentation. The next form is the recommendations. There are many recommendations that massage therapists can give, so therefore we created a new section. There is also another tab at the top that is for insurance use or specific goals, such as increasing time spent in the area. There are many examples listed for short-term and long-term goals here, and also if you have any recommendations of co-management. But in the top section here is where you'll list the referral for auto or work comp cases. This area is not used for massage interns, but it is here for your use when you need it. The first tab of recommendations is any post-treatment, such as giving them water, education of posture, overuse, overload, compensation, or muscle anatomy, any hydrotherapy guidelines or recommendations, and if you want to continue treatment, this is the area that would be considered the treatment plan. We would indicate any modalities that we would like to do next time, any specific techniques or other techniques that you know of that you would recommend, and your return or follow-up visit. You can select more than one here, so if you say every 2 weeks as maintenance for 4 to 6 sessions as needed, and maybe reassess next year. The last part of the note is if you want to recommend any areas to work the next session. For this indication, I'm going to say to work the scalenes again. Just giving an example here of paraspinals as well. When you've completed these forms, you have to go back to the text version as an intern to sign the note. You will go to the bottom here and type in .I sign, and it will automatically enter your intern name, date, and timestamp. For supervisors or billable providers, you will not need to do this. Interns are not allowed to sign notes, so this is where you would sign if you're creating the document as an intern. Once you are done with the note, it is okay for you to review the text translation that will be the permanent document here. Each color is identifying a different form that was used, or a form that was not used in this case. The quotations here will not be loaded in the final form, but you will see there's subjective, objective, assessment, procedures, and recommendations. When you are done, you will click the End button. Again, as an intern, this will not be highlighted. You will not be able to sign the note. So the only two options for you is to either discard the note and delete it permanently, or hold the document. If you are not finished and you want to place it back on your desktop, select yourself to route it to and click Hold. If you are finished and you want it to go to the provider, and in this case I am a provider, so it will not select, I can look for a provider's name here. Once you have selected the name, it will preload into the routing information. Click OK, and it will show up in this list here. Then you'll place Hold Document, and it will route it to them. And as you can see in the upper left-hand corner, since I am in a demo patient, you will see 3 documents ready to be edited. If you follow down to the Documents section, you will also see pencil marks here that need to be signed. You will also see in the upper left-hand corner next to your login name 3 documents that are unsigned. So in front of me I have 3 ways of indicating that I need to sign 3 notes. If you are done with the note, it will leave your desktop and go to your provider for signature. This concludes the daily chart note. Next I will go into the initial evaluation and key concepts for massage therapists.